Congratulations and welcome to your first trimester. This is where the fun really begins. Your first trimester is from the moment you are told that you are pregnant, whether that be from a home pregnancy test or from a pregnancy test that is done by a health professional, all the way up until the 12th week of your pregnancy. We calculate this based on a couple of different factors. The first day of your last period gives us a rough estimated date that we can expect your pregnancy to reach 40 weeks of gestation. So from 1 week through to 12 weeks is considered your first trimester. This brings with it lots and lots of hormonal and physical changes within your body. And there's some really common symptoms that you might incur. The first one being extreme fatigue. This is the kind of tiredness that you'll never be able to explain. The kind of tiredness where you might sleep a full night, wake up in the morning, have a shower, and immediately feel like you need to go back to bed. This is all to do with the energy that your body is using to grow your beautiful baby. And it's really common to feel like this. So take advantage when you can to rest. Take naps, sleep as long as you need to if it's possible, although it's not always easy if you've got other children. The other really common symptom that can be quite debilitating for some pregnancies is nausea, sometimes referred to as morning sickness, but can happen throughout the day and night in some circumstances. This is all to do with a huge surge in hormones that we experience in the first trimester. Some women will experience these symptoms a little bit longer into their second trimester and sometimes even into the third. However, it usually starts to disappear around the 12 to 16 week mark for most pregnancies. This morning sickness can happen at any point in the day and it comes over you like a wave of nausea. Sometimes it happens because you are hungry, sometimes it happens because of a smell, and sometimes it just happens out of the blue with no explanation. It's really important that you work out what works for you. Keep hydrated, eat the things that you can eat whilst being careful about the things that are recommended. And another little tip for you is carry around a little alcohol wipe. You know, the ones that you would use to just keep an area clean before you would do an injection, or if you've cut yourself. Those little alcohol wipes, just to smell, have been clinically proven to improve the symptoms of pregnancy sickness. Now, you may have heard of hyperemesis gravidarum. This is a severe form of pregnancy sickness and in some cases can end up with women being admitted into hospital where they need to be hydrated and looked after with a little bit more TLC. If you are unable to keep food down and water, then we would recommend seeking more advanced help from your GP or your midwife. You might also experience symptoms like breast tenderness, body aches, and some women even experience some spotting in the early weeks of their pregnancies. This is really normal and is actually very common. However, if you're concerned, then I would recommend that you get in touch with either your early pregnancy unit, your GP, or your local midwife. Here in the UK, you would experience a variety of different cares in the first trimester. You would access your midwife through a couple of different avenues. In some areas, you would access the GP and they will refer you directly to your local midwifery team. In other areas, you might access your midwife directly through a self-referral form on the online trust portal in your local geographical area. And in some circumstances, women choose to divert themselves away from the traditional care models and access privately practicing midwives like myself, who can do the same cares as your traditional midwives within the NHS, or they can access and arrange other care provision across the system, including scans and blood tests. Your first appointment with your local community midwife will probably be between 8 to 10 weeks. At this point in your pregnancy, you might be experiencing some of those symptoms that we've already talked about. And at that first appointment, you can expect to be with the midwife for up to an hour, sometimes a little bit longer if you've got more of a complex history. At that first appointment, it is a fact-finding exercise, not just for the midwives, but also for you. At this first contact, we will also take some clinical markers, like your blood pressure, send off a urine sample, and do some blood tests. We'll also refer you for your scans at that appointment too. You can expect that appointment to have lots of questions involved. We're going to look at your clinical history, your medical background, your partner's history, and any pregnancy symptoms or history that you might have from previous pregnancies. So don't be surprised if this appointment takes a little bit longer and you have to answer lots of questions. I also recommend that you take a list of things that you might want to ask your midwife as well. Things like, where are your birthplace choices? What are your care options? And what can you expect to experience in terms of educational provision throughout your pregnancy? Following on from this first appointment, your midwife will recommend and refer for your first scan. Traditionally known as the dating scan, this scan is usually taking place between 11 and 14 weeks. The reason that this happens at this point in your pregnancy is because if you choose to have invasive screening, a simple blood test that will scan for conditions like Down syndrome, Edwards and Patau syndrome, then it needs to be done within this clinical window to get the most accurate and best result for you. Your midwife should discuss all of these options with you at that first appointment before you make the choice about what scan you would like to choose. Some women will opt in for all of those options, and other women only want to go and have their dates written down and approved. Remember that a full and healthy term pregnancy can run anything from 37 weeks all the way up until 42 weeks, and in many cases, your estimated due date based on the first day of your last period sometimes doesn't match up with the scans that we do in the first trimester. That's okay, it's all about giving us an estimation. So that's a really rough overview of the first trimester. Let's go on and talk about the second.